Hello there and a warm welcome to News Across Nigeria, where we bring you news from the 6 geopolitical zones of the country, the 36 states in the Federation. I'm Lamidi Adeosun. Thank you for joining us. And we begin in the northeastern part of the country. Soldiers of the Nigerian Army Medical Corps in Borno State have taken medical care to liberated villages where residents displaced from remote communities are currently being camped. 800 internally displaced persons have so far accessed the Medicare under the military intervention scheme. The general officer commanding the 7th Division, Lamidi Adeosun, says the free medical care was in line with the directives of the Chief of Army Staff to discourage displaced persons in already liberated areas from moving to Maiduguri.
The team of military medics attending to the sick in Kunduga town, about 35 kilometers from Maiduguri, over 1,000 villagers trapped by insurgents in remote villages and cut off from the outer world until a few weeks ago when the army sacked them, are among the beneficiaries. The General Officer Commanding 7th Division, Major General Lamidi Adeosun, says there is no need to proceed to Maiduguri, the state capital.
Some of the people that are already in Maiduguri, to also encourage them to go back to the liberated areas so that gradually they can start picking up the pieces of their lives again. Because if the places remain unoccupied, it will remain desolated and people will not be able to at least break away from this IDP status. So it is important to attend to their health. Most of them are just coming out of the bushes. We see some of the children that are malnourished, they lack medical attention, no food, nothing. So based on that, at the military level, we are doing all we can to support them.
Cases of malaria is most prevalent among those attended to.
A lot of cases of malaria, a lot of cases of worms, and we have a lot of cases of peptic ulcer diseases.
A similar exercise is being conducted by the Nigerian Air Force within the capital city, where 8 out of 23 IDP camps have played host to the medics. Camp leaders have continued to complain of mosquito bites and other health conditions common in the rainy season.
We have been having problems with our health because of the rainy season and mosquitoes. Many of us are just lying down here, and there are no drugs, but we thank God for the help that has now come our way.
The commanding officer of the Nigerian Air Force Medical Center, Wing Commander Solomon Ilya, has been talking to coordinating agencies on the need for setting up preventive measures.
After visiting camps, I always liaise with the camp clinics and international donor agencies or organizations like Medicines Sans Frontiers, ICRC, UNICEF, then other indigenous organizations like NEMA, SEMA, on the need to provide basic necessities like insecticide-treated nets, soaps, to improve their hygiene. I've been in contact with them to ensure that they carry out those advice, actually, so that there will be improvements on the health condition of the IDPs.
To ensure the health situations in these camps does not deteriorate in the coming days, humanitarian workers and stakeholders would have to step up hygiene and anti-malaria campaigns among the internally displaced persons.
Also in the northern region, participants at a workshop on how to tackle rural banditry in northern Nigeria, in Kaduna State to be exact, have identified and recommended the gazetting of grazing resources and setting up of ranches and stock routes by states in the federal government as ways to end the incessant bloody clashes between herdsmen and farmers, as well as the increase of cattle rustling in those regions. They identified the shifting demographics of both human and livestock population, improper management of land and livestock resources, and changing ecological and environmental forces as some of the factors responsible for the crisis. In the last 5 years, cattle rustling has devastated thousands of livestock owners and farming communities, particularly in Kaduna, Zamfara, Katsina, Niger, Plateau, Benue, and Taraba states. In such cases, armed bandits attacked herdsmen, carting away their animals and in most cases, leaving their victims critically injured. Meanwhile, the Kaduna State Governor, Malam Nasir El-Rufai, has lauded the role of the Nigerian Air Force in fighting insurgency in the northeastern part of the country. Governor El-Rufai was speaking to officers and men of the Air Force Institute of Technology in Kaduna State during the 44th convocation ceremony. He also lauded the institute for its research and technological development it's achieved in recent times.
We are very proud of the fact that your institute is yet another center of academic excellence located in Kaduna State. The Air Force can be rightly proud of the strides of this institute in research and development. We've noted the institute's design and manufacture of an unmanned aerial vehicle, AMEBO. We also warmly welcome the institute's design of an unmanned ground vehicle that can assist security forces to defuse bombs and other explosives. We look forward to scaling up these initiatives to help boost our national security assets. As in other spheres of modern life, defense and national security are technology-driven, relying on the knowledge, skills, and dedicated effort of well-trained personnel. This institute is a testament that the Air Force understands the imperative of technology, and we commend the vision of its founding fathers to establish and provide continued support for its activities. We congratulate the staff of the Institute for these efforts and the dedication with which they are imparting skills and knowledge to their students.
Governor of Kaduna State, Nasir El-Rufai. You're watching News Across Nigeria. After the break, we will touch down in the south-south part of the country, where the Edo State House of Assembly speaks on the Physical Disability Bill. Please stay with us.
You don't have to.